Treatment-related leukemia, what women need to know when choosing breast cancer treatment. Breast cancer accounts for 1/3 of cancer cases annually in the United States and is the second leading cause of cancer-related deaths among women. When women are seeking treatment, they are bombarded with different treatment options. Traditionally, treatment options include chemotherapy, radiation, or surgery. Recent studies suggest that a combination of radiation and chemotherapy can cause acute myeloid leukemia or myelodysplastic syndrome. Recently, data suggests that 10 to 20% of AML cases are from treatment with chemotherapy and radiation, specifically alkylating agents and anthracyclines. Now that this information is available, we need to educate women about their treatment options. Healthy People 2020 addresses cancer prevention strategies such as avoiding chemicals, harmful UV light sources, smoking cessation, and eating a balanced diet with regular exercise. They also address thrombocytopenia, which is a low platelet count. Signs of thrombocytopenia include bruising, petechiae, and bleeding. Thrombocytopenia can be any side effect of chemotherapy. Often the choice chemotherapies for breast cancer treatment are anthracyclines such as doxorubicin, idarubicin, daunorubicin, mitoxantrone, and epirubicin. Anthracyclines work by halting DNA replication at the transcription site in the cell cycle. Alkylating agents such as cyclophosphamide, melphalan, busulfan, carmustine, ifosfamide, carboplatin, and carmustine are alkylating agents. They work by attacking the DNA at all phases of replication. They are non-cell cycle specific. Radiation works similarly by damaging DNA to prevent cell replication. The problem is that chemotherapy and radiation cannot distinguish between healthy cells and cancer cells, thus harming the healthy cells as well. It is estimated that 10 out of every 2,000 treated with chemotherapy and radiation will be diagnosed with myelodysplastic syndrome or acute myeloid leukemia. Globally, breast cancer is the most common cancer. It is estimated that 1 in 8 will develop breast cancer in her lifetime. This chart breaks down the odds of a woman getting breast cancer. At age 30, a woman has a 1 in 233 chance of developing breast cancer, while a woman over the age of 70 has a 1 in 8 chance. This chart also includes estrogen exposure and heredity. Women diagnosed with breast cancer face many physical, psychological, and socioeconomic issues. A woman who is treated surgically may have a lower self-esteem and feel that her femininity is being threatened. A woman who is treated with chemotherapy and radiation may feel pain and fear. Any illness requiring hospitalization impacts a patient's family role and causes financial burden. Nurses can inform patients about short and long-term effects of her treatment decisions. We can suggest resources such as counseling, support groups, and ways to maintain overall health and well-being. We can also suggest information on clinical trials if they are available. My greatest area of learning is that women who develop treatment-related leukemia from combination therapy are often treated with the same chemotherapy that caused the leukemia. Also, the 1 in 8 applies to women over the age of 70, not young women and middle-aged women. While breast cancer is so prevalent, women need to be better educated about cancer treatment options. A woman may have opted for a mastectomy if she would have known about the long-term side effects and possibility of myelodysplastic syndrome or acute myeloid leukemia. Nurses can provide women with education, support, and offer community resources to the patient diagnosed. AML is a fatal disease with a long, complicated treatment path. Women need to understand the impact of their decisions about cancer treatment.